Hello, I'm Dr. Bruce Eisenberg. Welcome again to Back to Health, the longest running show on Staten Island Community Television. It's been a pleasure all these years to bring Back to Health to your home so we can share information about health, very important information, so we can all live more complete, more healthy lives. And it's an honor to be welcomed to your homes all these times. Before we begin today's show, I want to give a shout out to my students at the College of Staten Island. I have the privilege of teaching many students who are going into healthcare careers. I teach courses in anatomy, physiology, biochemistry, and we're just wrapping up a semester now, so I want to wish all of my students good luck in your pursuit of your healthcare careers. So I really just wanted to share that for a moment. Now, in today's Back to Health, unlike many of our shows where we bring on very interesting guests with various health-related perspectives, today I'm going to be answering a series of very commonly asked health-related questions. Some about chiropractic, some on other topics. Of course, I'm a chiropractor on Staten Island, so we'll talk about chiropractic. We'll talk about other topics on Back to Health all the time. So we'll be answering some very commonly asked questions that you, our audience, have been asking. By the way, if you ever have any questions you'd like us to address on Back to Health, or if you'd like us to discuss any topics, if you are one of our viewers, or if you're another healthcare professional, or you have an interesting topic that you'd like to talk about, feel free to contact us. You can write to me at Dr. Bruce Eisenberg, E-I-S-E-N-B-E-R-G, at 941 Jewett Avenue, that's J-E-W-E-T-T, 941 Jewett Avenue, Staten Island, New York, 10314. So you can write your suggestions, your topics, your questions, and we'll try to address them here on Back to Health. Remember, this show's here to serve you, to give information to you. So if there's a topic you'd like us to discuss, please feel free to contact us. Or you can call my office at 718-727-7529. And again, if you have suggestions for a future topic, if you have questions you'd like us to answer, please feel free to send it to us and we can talk about it on Back to Health. Now, the first series of questions, these are a bunch of questions that really are interrelated, so I'm going to try to answer them all together. This is about chiropractic. So to begin with, how does chiropractic work? We all know that chiropractic is a very effective approach to healthcare. How does it work? Why does it work? Now, everyone knows about chiropractic in terms of benefiting spinal problems, but also very often there are things that are not right at the spine, that are far away from the spine, that respond to chiropractic care. So why is that? How does chiropractic affect parts of the body that are not right at the spine? And so along with that topic, the questions of what are pinched nerves or vertebral subluxation, that we use the term used in chiropractic, and what are chiropractic adjustments. So these are all interrelated questions, and so we're going to talk about that now. We have to look at the spine. Now, if we understand the setup of the nervous system, we have the central nervous system, which is made up of the brain and the spinal cord. The brain, of course, is protected by the skull. The spinal cord is protected by these bones, which are called vertebrae. The vertebrae make up the spinal column, the backbone, it's all the same. These are the vertebrae, and these bones protect the spinal cord. The spinal cord is just an extension of the brain. Now, we have an amazing system in the body where we have certain areas that are very sensitive and have to be protected. So, for instance, the brain is very, very sensitive. So we have a bony vault, the skull, the cranium that protects the brain. Some sensitive organs of the body are more superficial, like the kidneys are more superficial. They're more prone to injury, so God gave us two of them. So we have some amazing systems in the body that give us function and protection. So we have the brain, which is protected by the skull, and we have the spinal cord, which is an extension of the brain, that's protected by the vertebrae. Now, we have a very interesting system with the vertebrae in that we have protection, but also have flexibility and movement. The vertebrae can move around. That's why we can bend and turn in different directions, because we have that flexibility. So the way this is set up is we have the vertebrae, and in between the vertebrae we have cushions or shock absorbers. So we have vertebrae which are bone. We have these cushions or shock absorbers between the vertebrae. These cushions or shock absorbers are called the intervertebral discs. These discs are fibrocartilage. They're tough, they're strong, but they have more give to it than bone does. So this allows for movement. So we have the system, we have the protection of the spinal cord afforded by the vertebrae, which are bone, and you also have the flexibility allowed by the intervertebral discs. So you hear about people having slip disc, herniated disc. These are what they're talking about. These are the discs between the vertebrae. So again, we have the spinal cord, which is an extension of the brain, and we have the vertebrae protecting the spinal cord. Now these vertebrae go in and out of place all the time. That's what gives us movement. They go out of place, then they go back into place. Sometimes a vertebra, when it goes out of place, will get stuck. And we'll talk about what happens in a moment. So looking at the spinal cord, we have nerves that go out from the spinal cord to all different organs, muscles, tissue, cells, and limbs of the body. So the only way for the message to get from the brain to the various parts of the body, or from the parts of the body back to the brain, is by going from the brain to the spinal cord, out these spinal nerves, and to all the parts of the body, and from these body parts back to the spinal nerves, and the spinal cord back to the brain. And these nerves come out in openings between the vertebrae. So we talked a moment ago how vertebrae can get fixated, they get stuck. When that happens, it can compromise the opening that a nerve is coming out of. So when a vertebra compromises an opening that a nerve is coming out of, that can cause problems, that can cause pressure on the spinal nerves. In chiropractic, the term that we commonly use is a vertebral subluxation. All that means is that the vertebra is out of place just a little bit. We're not talking about a massive dislocation. We're talking about subluxation, a little bit out of place. And what happens is when the vertebra goes out of place, or even gets fixated, so you don't have full movement there. It doesn't even have to be out of place. It gets fixated. That can put pressure on the spinal nerve. And then whatever part of the body is supplied by the nerve can be affected. So the common term that people use is a pinched nerve. The nerve has pressure on it, and it can affect whatever part of the body is supplied by that nerve. So what happens is the vertebrae get fixated, and they put pressure on the spinal nerves. We call that a vertebral subluxation or pinched nerve. And that's what chiropractors have their expertise in locating and correcting. The doctor of chiropractic has specialized training in locating vertebral subluxations. And the doctor of chiropractic has specialized training in correcting these vertebral subluxations. We have techniques known as the chiropractic adjustment, where we manually adjust the vertebra back into place. We set it into motion, let the body put it back into place to relieve the nerve pressure, to allow the body to restore itself to optimal health. So if someone has back pain, rather than masking the pain with a painkiller, the chiropractic approach is finding the cause of the problem and correcting it. Now, if you have neck pain, back pain, stiffness, there's a good chance that there are vertebrae out of place putting pressure on the spinal nerves. And the doctor of chiropractic is the specialist in locating these vertebrae that are out of place and correcting it with a chiropractic adjustment. And very often, people will have vertebrae out of place for a long time before they become symptomatic. So it's a good idea for a person to have his or her spine checked out on a regular basis and not wait for the pain. The doctor of chiropractic will very often locate vertebral subluxations even before symptoms appear and hopefully prevent the symptoms from appearing. Now, the technique that we use to correct the vertebral subluxations is a chiropractic adjustment. That's where when we've located the vertebra that's out of place, we adjust the vertebra back into place. Now, the traditional adjustment is done by hand. As a matter of fact, the term chiropractic comes from the Greek words chiropraktikos, meaning done by hand. So the adjustment done by hand is a traditional type of chiropractic adjustment. There are many other types of chiropractic adjustments that some chiropractors like myself use today. We have some adjustments which are considered non-force adjustments, which are less traumatic than the traditional hands-on chiropractic adjustment. Now, the chiropractic adjustment that's done by hand is very effective. I still use it with many, many patients. It's a very important part of chiropractic. But in addition to the traditional chiropractic adjustment, there are non-force adjustments. And this is very important because this makes chiropractic available to people who might not have been able to get a regular adjustment before. If someone has osteoporosis, which is something we'll be talking more about later, where the bones are somewhat brittle, or if someone's just squeamish about the little popping and cracking sounds that the adjustments can sometimes make. We have the non-force adjustments, which are, as I said, they're less traumatic, and they also, you don't hear the sounds that you have with the traditional adjustments. So if someone is squeamish about the traditional chiropractic adjustment, or they have some kind of condition in their bones that precludes the opportunity of the chiropractic adjustment, the non-force adjustments make chiropractic available to these people. So just to run through it all again, we have the spinal nerves that go from between the vertebrae to all different parts of the body. the vertebrae get fixated and put pressure on those spinal nerves in what we call a vertebral subluxation or pinched nerve. And the doctor of chiropractic will locate these vertebral subluxations and adjust the vertebrae back into place to correct the subluxations, relieve the nerve pressure, to allow the body to restore itself to optimal health. So people with neck pain, with back pain, with stiffness, with achiness, this is really the most effective way of treating these conditions. And the beauty of chiropractic is that it's done naturally. Nothing artificial is put into the body, no medication, no painkillers, and nothing is cut away from the body. We just naturally work with the body to allow the body to restore itself to optimal health. And the main treatment that we use is the chiropractic adjustment, whether it's a traditional hands-on adjustment or the instrument adjustments that are also available today. Now, in addition to the chiropractic adjustment, many of us use what we call adjunctive therapy. Now, some chiropractors are against the use of adjunctive therapy. My personal feeling that anything that I can use to help my patients within my legal scope of practice, I want to do. So we use what's called adjunctive therapy. So we use things like electrical stimulation. Some chiropractors use ultrasound. We might use heat or ice. We might use various adjunctive therapies in order to facilitate the chiropractic adjustment. While the chiropractic adjustment is our main procedure, that's where chiropractors have their specialized training, but the other forms of therapy, the adjunctive therapy, can be useful to facilitate the chiropractic adjustment. In our office, we take a very holistic approach in terms of using adjunctive therapy and also incorporating nutrition into the treatment plan if it's indicated. We utilize exercises to rehab the spine. So we use a very holistic approach in order to get the main benefits of the chiropractic care. Now, it's important to bear in mind that if a patient comes to my office and that person has a condition that's not a chiropractic condition, I do not want to treat that patient. I want to refer that patient to the appropriate specialist. So if, for example, that patient comes in and they have a fractured vertebra, I'd refer them to an orthopedic surgeon. I want patients that are going to come to my office and get well. If they need another specialist, I am more than happy to refer them to the appropriate specialist to get the type of care that they need. So within chiropractic, we treat these spinal conditions. But again, if it's not a condition that's within our scope of practice, things like broken vertebrae, broken bones, these things we do not treat in chiropractic. We refer the patient to the appropriate medical specialist. Now, we talked a moment ago about the discs. Discs are cushions or shock absorbers between the vertebrae. They're fibrocartilage. They're tough, but they're not as hard as bone. And that's what gives us flexibility. But the fibrocartilage is made out of can be injured also. And that's where people have things like disc herniations, where you actually have tearing of the disc and disc material coming out. When damage a disc, it can be a very difficult thing to manage because discs don't heal very well, which is why there's some people who have such severe damage they need surgery. Usually in the chiropractic care, we can try to prevent that from happening. There are some nutritional protocols that are helpful with that, and the chiropractic adjustments can help line everything up. But the discs are these shock absorbers between the vertebrae, and they are very often prone to injury. So that's basically how chiropractic works. Now, the question about how can chiropractic affect areas that are not right at the spine is because you have to follow where these nerves go. If there's pressure on a nerve and that nerve goes down into the arm, you might have pain, numbness, tingling radiating through the arm. If it's a nerve that goes down into the thigh or leg, you could have pain through that area. And you could even have organic problems that are mimicked by vertebral subluxations, because these nerves go to all different parts of the body. So if there's pressure on one of these nerves, it doesn't just manifest at the spine. Yeah, many people have the neck pain or the back pain, but very often people will have the pain in an area where that nerve goes to that's far away from the spine, but it's actually caused by the pinched nerve at the spine. Now that brings to mind another very commonly asked question, that question, what is sciatica? A lot of people have sciatic nerve irritation known as sciatica. And this really fits in with what we were just talking about. The sciatic nerve is a very large nerve that starts in the low back. It has supply from the lumbar area and from the sacral area. And so you have the sciatic nerve that goes down into the thigh and then it branches off into the legs. Now if a person has a pinched nerve and that nerve, the sciatic nerve, that person can feel pain, sometimes severe pain, radiating down the thigh and into the leg. And sometimes it'll be pain, sometimes it'll be numbness, tingling, and that's called sciatica. It's a very common condition. It's one of the most common conditions that keep people out of work, where there's a pinched nerve in the low back shooting down into the lower extremity. And so that's called sciatica. And it's a very, very common condition that we see in a chiropractic office. Chiropractic is the most effective way of treating sciatic nerve irritation. It's not surgical. We're not going to sever the sciatic nerve. It's not masking the pain with medications, but it's a matter of locating the vertebrae that are out of place and adjusting those vertebrae to correct the subluxation so we relieve the nerve pressure and allow the body to restore itself to optimal health. And sciatica responds very, very well to chiropractic care. And it's one of the very common conditions that we see in a chiropractic office. Now, another question that comes up very often is, what is whiplash? There are many people that suffer whiplash injuries. The most common type comes from car accidents. It can also be from a fall. Even a bad sneeze can sometimes cause a whiplash injury. A whiplash injury is where the head is thrown backwards and forwards. We call it hyperextension, hyperflexion. So if someone's in a car accident and they're hit from the rear, the head gets thrown backwards and forward. If they get hit in the front, the head will usually be thrown forward and backwards. Either way, the head goes thrown like a whip, and we call it a whiplash injury. It's also a very common condition that we see in chiropractic offices, and it's something that responds very, very well to chiropractic care. Depending on the extent of the damage, there'll be variation in terms of how long it takes to treat such a condition. Sometimes there can be damage to the tendons and ligaments. Sometimes there can be damage to the cervical disc, cervical spine is the next cervical disc. But sciatica is a very common condition that we see in a chiropractic office, and it responds very, very well to chiropractic care. And again, it's one of the things that we see very, very often. So if a person gets into a car accident, it's important to get their spine checked out for possible injury. And it's interesting. Some people walk away from an accident and not feel very much pain at all. Then a day or two later, they start to feel severe pain. So it's important to keep your eyes open after a traumatic injury for symptoms that turn up a day or two, or even a little longer than that, but very often a day or two later. And one of the common conditions is a whiplash, where the head has gone backwards and forwards, and as a result of that, they have a neck injury. Now, there are certain things that can make a whiplash injury more severe, and this is all part of doing a good case history. And this is one of the points that I try to drive home to my students at the college all the time. When you see a new patient, you have to do a thorough case history. If you know the mechanism of injury, you'll have a better idea as to what the problem is and how to treat the problem. So, for example, two people sitting in a car, both facing front, both in similar health, they get hit from the rear by another car. One of them has a more serious injury than the other. Now, some people will have inherent weaknesses, but assuming that's not there, one person may have a more serious injury than the other. If you do a thorough case history and you find out facts like whether or not they were wearing seat belts, for example, but another thing, what they were doing at the time. If at the time of the impact, if one person was looking straight ahead and the other person had the head turned, for example, if they were looking out the window, if they were talking to the other person, if the head was turned, that will make it a much more serious injury because you have ligaments and tendons that are very, very strong in a specific direction. So when they get extended and flexed, they're pretty strong. When you add rotation to it, they're not nearly as strong. So if you've done a thorough case history, you know that the patient's head was turned, and that will cause a more serious injury. So it's important for the doctor or the healthcare professional to do a very thorough case history so you get a better understanding of the mechanism of injury, and that makes it gives you much more ability to treat the condition. So the mechanism of injury is very important. This is also very important in sports injuries, and I have a graduate degree in sports injuries. Well, sports injuries also is very important that the player step down on the side of their foot, that they twist in a certain way. And again, if you do a thorough case history and you determine the mechanism of injury, if you have videotape footage, that's great also. But if you know the mechanism of injury, that'll help you to more effectively evaluate the condition and therefore more effectively treat the condition. Okay, so those are some interesting questions. Another question that comes up all the time, people ask about osteoarthritis and osteoporosis. They want to know what these things are, and they want to know if they're the same thing. Well, osteoarthritis and osteoporosis are not the same thing at all. Very often, we'll see them together, and I'll explain why shortly, but osteoarthritis and osteoporosis are two very different things. Osteoarthritis is also known as degenerative arthritis. That's a result of wear and tear. It's mechanical. So when you have bones that are rubbing against each other at the joints, they can start to wear out. Now, anything that puts increased wear and tear on a joint, either any abnormal positioning, any additional wear and tear, that will bring on osteoarthritis at an earlier age or accelerate the osteoarthritic changes. Now, pretty much everybody, if they live long enough, they're going to get osteoarthritis. It's all part of the aging process, the wear and tear on the joints. But again, if there's anything that puts more pressure on the joints, more wear and tear, you can see osteoarthritis at a lot younger age. So for example, if you've had a traumatic injury, let's say you were a young person that was in a car accident. As a result of the car accident, you might see osteoarthritis appearing at a younger age. If you were an athlete, if you were a high school or college football player, the damage that you do to your joints very often will bring on osteoarthritis at a younger age. I've had a number of patients that are professional wrestlers, and those of you who watch Back to Health know we've had a number of professional wrestlers on the show. Some very famous wrestlers have been with us at Back to Health. And you can have young fellows in their 20s and 30s, but because of the trauma to their joints, have osteoarthritis at an earlier age. So osteoarthritis, if you live long enough, everybody gets it. It's just wear and tear on the joint. It's mechanical. It tends to be associated with old age, but you can get it a lot younger if you have anything that causes more wear and tear or aberrant movements at a joint. So bad postural habits, being overweight, having a job where you do a lot of bending and twisting, or if you've been an athlete or you've been in a traumatic injury, a car accident, these are all things that will accelerate the osteoarthritic changes. Now, osteoporosis is something completely different. Osteoporosis is where there's a loss of calcium in the bones, making the bones brittle. And as a result of this, the bones can fracture very easily. A person with osteoporosis, they can make a quick movement, a slight fall, and wind up fracturing bones, breaking bones, because the bones tend to be very brittle. Now, osteoarthritis, pretty much everybody gets. Osteoporosis, not everybody gets. The most common time that you'll see osteoporosis is with postmenopausal women from the hormonal changes, which is why a lot of women, when they go through menopause, will take supplements like vitamin D and calcium, and some will go through hormonal replacement therapy. But a very common time to see osteoporosis is postmenopausal women. But that's not every case of osteoporosis. Men can get osteoporosis. You get it at any age. Things like steroid abuse will also stimulate osteoporosis. And also not every woman going through menopause gets osteoporosis. So it's not a 1-to-1 ratio. So the most common situation where you see osteoporosis is postmenopausal women, but that's not by no means the only time you'll see osteoporosis. And again, not every woman going through menopause will get osteoporosis. Now, we'll very often see osteoporosis and osteoarthritis together because they both happen later in life. So if you have a woman who's 60 years old and she has osteoporosis as a result of the hormonal changes in menopause, she'll probably have osteoarthritis also, just because most people who are 60 years old will have osteoarthritis. So very often you see the two conditions running together, but they're two completely different conditions. By the way, osteoarthritis, we manage it very effectively with chiropractic. We can't undo the arthritis, but we can maintain the mobility of the vertebrae and reduce the pain and increase function. There are also some nutritional supplements that help with that, glucosamine chondroitin, hyaluronic acid. So there are nutritional approaches that are very helpful with osteoarthritis. Osteoporosis sometimes requires hormonal replacement therapy. Vitamin D and calcium is very often used, so there are nutritional protocols that are helpful with osteoporosis as well. So osteoarthritis and osteoporosis are two completely different things, but very often you'll see them running together. But before we wrap up today's Back to Health, we have some important pieces of information that I'd like to share with you. These are some sheets, some forms that if you'd like a copy of any of them, you contact me. We'll be happy to send them to you. You can write to Dr. Bruce Eisenberg, 941 Jewett Avenue, Staten Island, New York, 10314, or call us at 718-727-7529. First one is getting along with your back, getting along with your spine. Very often we can avoid back problems, avoid spinal problems with some modification of our activity of daily living, learning how to sit correctly, how to sleep correctly, how to stand correctly, how to bend correctly, how to lift correctly. So these are some rules on spinal care. And this is very important. We discuss with all of our patients ways to avoid spinal problems. And we'll be happy to send anyone who'd like a copy of that sheet. Walking for health. Walking is a very good way of maintaining health and well-being without the impact of jogging, but maintaining the well-being of the body. Walking is a great exercise. Backpack safety, something that we've talked about many times on Back to Health. Children very often wear these backpacks that are too heavy for them. And there are some important rules on backpack safety. And we have articles from the American Chiropractic Association on osteoarthritis and on osteoporosis. These are things that we spoke about, things that we can do in terms of dealing with these problems and understanding them better. Now, very often we see newspaper articles with claims of new cures for this and that. I wrote an article for American Fitness magazine which addresses how to know which things are legitimate or not. Find the truth in medical research. If you'd like to get a copy of any of these things, please contact us. And I'd like to thank all of you for joining us on Back to Health. We're glad to share this time together. We'll see you again real soon. In the meantime, please stay healthy.